smoke, but have you noticed any increasing of smoking as like during times of midterms or finals or when you're more stressed? A lot of people, they start smoking when they're younger and adolescents, where they think smoking is cool, where in preparation they have a positive attitude about smoking. They're like, I would like to do that. There's definitely an in-group or a clique of smokers. This is a smoking campus, right? You're allowed to smoke on campus? Yeah? Okay. Where I went to undergrad, we had it was a non-smoking campus, but we had designated areas for smoking. So those smokers, they all knew each other, they had something in common, and they had something to relate to each other. So they were definitely formed this group between like smokers and non-smokers. Initiation, it is a rite of passage for some adolescents where they're experimenting different things that are new and somewhat mischievous. Becoming a smoker, this is when people consider themselves smoking. Okay, I tried it once, I thought it was cool, I tried it again, and now I do it regularly. And then maintaining the smoking habit is now I can't stop. So then smoking becomes an addiction. And we all are aware that smoking is related to cancer, but in stressful situations where people increase the amount that they smoke, they become more at risk for developing cancer or diseases related to the activity. As you can see, smoking is on the rise in younger students or children, where I know this is dated kind of back, but over a 5-year span, you can see the rise in the children who start to smoke. Okay, some psychological factors of illness, starting with the health community. Why are people not treating their illnesses, or why can't they start initiating more healthier habits? There's a physician-patient communication problem where possibly the patient doesn't understand what the doctor is talking about because he's using too many technical terms. It's like walking into the doctor's office, you explain your symptoms to him, and then he speaks pig Latin to you on how to get better. You'll walk out of that office not knowing what to do, but more often than not, you definitely won't come back because you'll feel like it was a waste of your time and money. There's also non-compliance of the physician's orders, where the physician will tell you, you're overweight, you need to construct a diet, you need to lose weight, and then maybe the patient will start, adjusting to the treatment, or they'll start a diet plan, they won't continue, or they just disagree with the doctor altogether. Maybe he diagnosed you with something, and then you were in denial, and you said that's not true. I'm not going to do anything about that because I disagree with you. Okay, I want you guys to get out a sheet of paper. And I want you to write down 5 stressors that you encountered yesterday. And then I want you to list if they were an acute stressor, was it a small stressor, or was it a large stressor? And what effect did it have on you? Did you start to feel sick? Did you become tired? Did you eat more related to the cause? And finally, I want you to write down what coping strategy you use, if you use any, and if not, what coping strategy would you use in the future? I'll write that down as you guys start to list your stressors.